Hello, my name is Marcelo Serna, and this is my pitch of a case study. So this is the question I got asked, which involves comparing enzyme and therapeutics to treat metabolic diseases and to list their advantages and disadvantages, also to determine which is a better option for people with these kinds of diseases. And yeah. So basically, we have four main type of therapies we can do for metabolic diseases. The first involves enzyme replacement therapy, which is effective, very effective, and can be used long term for the patient. But it is very, very expensive right now to do this kind of therapy. And since it is specific to the patient, this adds to the cost and the viability of the therapy. And now substrate reduction therapy, some advantages are that they can be taken via oral medication and are somewhat sustainable. But some disadvantages is that since it is more general, it can have limited effectivity, and sometimes it has to be used long term, like for life, so it can become very expensive. Now, chemical drugs are the least expensive and most available right now in the market for treating these kinds of diseases. But the disadvantages are that they are less effective. They're prone to have more side effects. The process of making these chemical drugs is very contaminates a lot, and patients can build resistance to these kinds of treatments. And finally, surgery is a great short-term solution for metabolic diseases, but they are very invasive. They can be often rejected by patients. They're not sustainable, and they are prone to side effects, and you're not assured that the disease won't come back after surgery. So it can be risky. So in general, I would conclude that right now, substrate reduction therapy is the best option since it is the most, since it has the most cost efficiency like value. In the future, as science progresses and methods become more less expensive, enzyme replacement therapy will be the better option for treating metabolic diseases. And well, some disadvantages of enzyme reduction therapy is that they are very expensive. But as I said, with further investigation and methods, it can be reduced and be like the default option for treating these kinds of diseases. And these are my references. Thank you.